Good evening, everybody. In today's class, let us try to understand about autonomic pharmacology. In that, we will try to understand the difference between parasympathetic nerves and sympathetic nerves and all concepts related to the autonomic nervous system in great detail along with the receptors of this autonomic pharmacology. Now, you see, before understanding this autonomic pharmacology, let us first try to discuss some basic things. See, everybody knows that in nervous system, mainly nervous system is divided mainly into central nervous system and peripheral nervous system, right? Nervous system is divided into central nervous system and peripheral nervous system. In all the classes, many times I explained this point, you should not forget. In central nervous system, what we have in central nervous system, we have brain and spinal cord, clear? This this is central nervous system, and peripheral nervous system is nothing but all the nerves which is arising from the central nervous system. It is called peripheral nervous system. And in peripheral nervous system is nothing but all the nerves. Okay, in peripheral nervous system we have, it is again divided into two types. One is somatic nervous system or somatic nerve fibers, and the second one is autonomic 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 nervous system or autonomic nervous system. See, somatic nerves are sensory in nature. एक चीज याद रख लो, somatic nerves are sensory in nature, and they are single fibers. They are single fibers. If somatic nerve is arising from the brain or spinal cord, directly it will go and attach on the skeletal muscles. So direct single nerve fiber is present in somatic nerves. And in autonomic nerves, again we have autonomic nerves are again divided into two more types. One is sympathetic nervous system or sympathetic nerves, and the second one is parasympathetic nerves. Okay, see, nervous system is divided into central nervous system, in that we have brain and spinal cord, and peripheral nervous system, in that we have all the nerves. Peripheral nervous system is again divided into somatic nervous system and autonomic nervous system. Somatic nervous system will have single nerve, and they are voluntary in nature. They are voluntary, they are controlled by our body. And autonomic nervous system are involuntary in nature, and they are not controlled by our body. They are not controlled by our body, but they are controlled themselves. They control themselves. That's why they are called autonomic. Auto means self. They are self controlling nerves, and these autonomic nerves will try to maintain homeostasis in the body. Very, very important. Somatic nerves are sensory nerves. They are controlled by our body. Somatic nerves are mainly innervated on the skeletal muscles. I want to kick the football, so my somatic nerves will send senses and I can kick the football through my skeletal muscles. Whereas autonomic nerves are innervated into many visceral organs. They are innervated into many visceral organs, starting from the heart, nerve, GI tract, all the endocrine glands, exocrine glands, urinary system, gastric glands, smooth muscles, blood vessels, pancreas, and all visceral organs are innervated by autonomic nerves. So they are involuntary in nature, and they control themselves and they maintain homeostasis. Clear? Now one more difference. Somatic nerves are made up of single nerve, right? Whereas autonomic nerve has two fibers. When nerve is coming out from the brain or spinal cord, it is having two branches or two fibers. The first fiber is called presynaptic nerve, and in between we have one junction which is called synapse, or it is also called ganglia. And from the ganglia, another fiber will be attaching to the tissue, directly to the tissue. So this is post synaptic or post ganglionic nerve fiber. See, in autonomic nerves we have two fibers. First fiber is called presynaptic or preganglionic fiber, and the second one is post ganglionic fiber or post synaptic nerve fiber. And in between we have ganglia, which is the junction actually. Okay, and the post ganglionic fiber is attaching to the tissue. Okay, post ganglionic fiber is attaching to the tissue, and in the tissue we have the post ganglionic fiber nerve ending, and tissue is having neuroaffector junction. This junction, see, the junction with post ganglionic, this is post ganglionic fiber. Post ganglionic fiber is attaching to the tissue, right? It is attaching to the tissue. The space between this post ganglionic fiber and this tissue, and here we have some space which is called a junction, which this junction is called neuroaffector junction. Neuroaffector junction. All these terms you should remember. In the next upcoming slides, you will understand better. This classification you all understood? Yes. Now you see, in autonomic nerves we have sympathetic nerves and parasympathetic nerves. Clear? Sympathetic nerves are those nerves which will synthesize, store and release noradrenaline as their neurotransmitter. See, in all nerve fibers will be synthesizing, storing, and they will be releasing some chemical mediators, some neurotransmitters. Okay. The main neurotransmitter which is present in sympathetic nerve is noradrenaline or norepinephrine. It is also called norepinephrine. And the neurotransmitter which is synthesized, stored and released by parasympathetic nerve is acetylcholine. Acetylcholine. These points already I think you know. Sympathetic nerves will synthesize, store and release noradrenaline. Parasympathetic nerves will release acetylcholine. So sympathetic nerves are also called adrenergic nerves. Clear? And parasympathetic nerves are also called cholinergic nerves. Cholinergic nerves. Understood everybody? Understood everybody? This classification understood? Now few more confusing points are there. Let me explain you some confusing points. See, in autonomic pharmacology, I see this is the general classification. Just now I explained you. Central nervous system is divided into actually they are afferent and efferent nerves. Afferent nerves are the nerves which are sensing from the peripheral tissues to the brain. Okay. Efferent nerves which will send information from the brain to the other tissues, they are efferent nerves mainly. These are predominant actions. Okay. Along with these, they will act as efferent and afferent also. So mainly this is dominant action. So in efferent neurons we have autonomic and somatic. Here autonomic and somatic. In autonomic nerves we have sympathetic and parasympathetic. Okay. So sympathetic and parasympathetic just now I explained. Somatic also just now I explained. I think this is clear to you. Now you see everybody should try to concentrate here. It is very important concept. See, we have sympathetic nerves, right? Sympathetic nerves are they are adrenergic nerves. Sympathetic nerves are also called adrenergic nerves. Clear? See, these adrenergic nerves, just imagine this is brain, and this is spinal cord, right? This is brain and this is spinal cord. Clear? See, all the peripheral nervous system, all the peripheral nerves will be arising from the brain. They will be arising from the brain. Okay. And they will be from the brain or from the spinal cord, and they will be attaching to the tissues, right? So somatic nerves will have single nerve fiber, and sympathetic and parasympathetic will have two fibers. All these things in basic things we have already discussed. Now you see the brain and spinal cord. See, in spinal cord all the peripheral nerves will be arising from the brain and spinal cord. Clear? See, in spinal cord we have all vertebrae. I think we have 33 vertebrae, I think. Okay. See, from these vertebrae and from the brain, in brain we have cranial nerves, and in vertebrae we have vertebral nerves. So all the peripheral nerves will be arising from brain and spinal cord. This point is clear. See, sympathetic nerves or adrenergic nerves will arise from thoracic area, from here thoracic area to L3. So sympathetic nerves are simply they arise from the thoracic lumbar region. So they are called thoraco lumbar nerves. Thoracolumbar nerves. Sympathetic nerves or adrenergic nerves will be releasing from T1 to L3. All the sympathetic nerves which are arising from the thoracic region to lumbar region, all these nerves are sympathetic nerves. Simple. Sympathetic nerves कहाँ से release होते हैं? From where they are arising from from thoracic to L3. Okay. This thing you should understand. And from these are sympathetic nerves, and we have parasympathetic nerves. Parasympathetic nerves are arising from which part? Parasympathetic nerves are arising from two areas. One from brain and two from spinal cord. So in brain, सब लोग ध्यान से सुनो. See, in brain we have 12 cranial nerves, right? In brain we have cranial nerves. So the third cranial nerve, seventh cranial nerve, याद रख लो, ये names याद रख लो. Third, seventh, ninth and 10th. Cranial nerve 3, cranial nerve 7, cranial nerve 9 and cranial nerve 10. These four nerves are parasympathetic nerves. Parasympathetic nerves. This is first region of arising of parasympathetic nerve, and second region from where parasympathetic nerves are arised is from S2, S3 and S4. Here we have sacral vertebrae, S1 sorry S2, S3 and S4. So S2, S3, S4 are parasympathetic nerves, T1 to L3 are sympathetic nerves, and the cranial nerve 3, 7, 9, 10 are parasympathetic nerves. If anybody has spinal injury, or if anybody has cranial injury, or if anybody has any of this nerve injury, what will happen? The autonomic nerve, which is maintaining homeostasis of that particular tissue from where it is entering, that particular tissue will not show its action. For example, you see the 10th cranial nerve is called vagus nerve. मान लो, this vagus nerve is innervated into the stomach, small intestines, into the gastric glands and all. If this 10th cranial nerve is destroyed, or if this 10th cranial nerve is dysfunctioned due to cranial bleeding, or due to any mechanical injury, or due to thrombosis, or that cases, what will happen in stroke conditions? And in that conditions, if 10th cranial nerve is damaged, the actions which are performed by this 10th cranial nerve will not be performed. Digestion nahi hoga, gastric motility nahi hoga, patient can't swallow properly. So is a paralytic related symptoms can be seen in the patient. Okay, see, we are just discussing about sympathetic and parasympathetic nerves. We are not discussing about other sensory nerves. अपन इफेरेंट नर्व्स के बारे में अभी इफेरेंट नर्व्स के बारे में अभी कुछ भी नहीं सीखे हैं. दैट पॉइंट्स आई विल डिस्कस इन नेक्स्ट क्लास. ओके, I think you understood the different types of nerves which are arising from brain and spinal cord. Okay, clear? I think this point is clear to you all. Now you see, this is just a basic point. We have 33. अगर ये सब आप काउंट करेंगे तो it will be 33. Cervical vertebrae we have 7. Thoracic vertebrae we have 12. Cervical 7, thoracic 12, thoracic 12, lumbar 5. Sacrum, these are fused one. S1, S2, S3, S2, S3 and S4 are parasympathetic nerve. Parasympathetic nerve will be arising from here and from brain. Okay, and remaining from thoracic T1 to L3, T1 to L3. These are sympathetic nerves. Okay. Anyways, so this is just for understanding purpose. I explained you. Now you see, this is also just for understanding. So we have total 12 cranial nerves. You can see the names of each cranial nerve starting from first cranial nerve is olfactory, second is optic. Olfactory means it is innervating into the nose. Optic means it is innervating into the eyes mainly. Trigeminal nerve, this is very very important. Trigeminal nerve, it is innervated to the nose, to the mouth and to the tongue, to the mandibles. Okay, the single nerve is dividing into 3 branches. About this trigeminal nerve and trigeminal neuralgia करके concept we have, especially headache. In headache and in migraine, this trigeminal nerve plays very important role. Okay, this is 5th cranial nerve, and third one is oculomotor, and fourth one is trochlear, and we have 6th abducens, 7th is facial. So seventh cranial nerve is it is parasympathetic. Okay, parasympathetic facial nerve, and 8th is vestibulocochlear, ear के अंदर जाता. And we have 12th cranial nerve, hypoglossal, and we have 9th one is also parasympathetic nerve. Okay, and 10th one is vagus. Very very important. This 10th nerve is very important because it is innervated mainly to the GI tract, mainly in the stomach. See, one more important, very very important point. I'll explain you later about that. So just these are the different cranial nerves. Just for understanding purpose, I am explaining these things. Now you see. Now let us try to understand about parasympathetic. See, in autonomic nervous system, we have mainly sympathetic and parasympathetic, right? In today's class, we'll try to discuss in detail about parasympathetic nerves. Parasympathetic nerves, from where they are arising, we discussed. 4 nerves are arising from the cranial nerve, and remaining are arising from the sacral flow. Okay, sacral flow, just now I told. S2, S3, S2, S3, and S4. And in cranial we have 3, 7, याद रख लो 3, 7, 9 and 10. So parasympathetic nerves are arising from these two regions. Clear? Now, if these parasympathetic nerves are arising from this region, they will be innervating into some tissues, right? They are innervating into some tissues. And in that tissues, what actions will this parasympathetic nerve shows? And this parasympathetic nerve will release acetylcholine, right? It will release acetylcholine in the neuro here on the synapse in the ganglia, and it will also release acetylcholine in the neuroeffector junction. This is called neuroeffector junction. Here also it will release acetylcholine, and when it falls on this tissue, it will show some actions. That all things we'll discuss in today's lecture. See, before understanding the parasympathetic nerve in detail, let us first understand how acetylcholine is synthesized in the parasympathetic nerve, because parasympathetic nerves are those nerves which will synthesize, store and release acetylcholine as the main neurotransmitter. So parasympathetic nerve के अंदर neurotransmitter क्या है? Acetylcholine is the main neurotransmitter in the parasympathetic nerves. That's why they are called cholinergic nerves. Now you see, just imagine this is the parasympathetic nerve. See, in parasympathetic nerve we have preganglionic nerve fiber and postganglionic nerve fiber. Just imagine this is brain, this is preganglionic nerve fiber, and this is postganglionic nerve fiber, and middle we have ganglion. This is ganglion. Okay, just imagine this one, this total part is preganglionic nerve fiber. मान लो this is preganglionic nerve fiber. See, some nerves which are present in brain, are also having parasympathetic activity. Some parasympathetic nerves are also present in cranial, in the brain. In the brain also we have acetylcholine as neurotransmitter. Acetylcholine will be releasing in the brain also. Anyways, that one we'll discuss later. Now you see, every cell has mitochondria, right? Every cell has nucleus, mitochondria, Golgi apparatus, and all cell organelles. I think you might have already studied. However, some cells will not contain some of these cell organelles, like some RBCs will not contain nucleus, and some cells will not contain some other cell organelles. But mitochondria is present in each and every cell, because mitochondria is the energy packet, or which will mainly useful for Krebs cycle, which will be useful for synthesizing ATP molecules. Clear? See, so this is the mitochondria which is present in the nerve, because nerve is a cell. It is a neuron is a cell, right? From this mitochondria we have acetyl-CoA. From where this acetyl-CoA is coming, do you know? See, when we take carbohydrates enters into the small intestine, absorbed as glucose. This glucose goes to the cell. In the cell cytoplasm, glucose converts into pyruvic acid by glycolysis process. 10 reactions होंगे. This pyruvic acid again enters into mitochondria. This pyruvic acid enters into mitochondria, and in mitochondria, pyruvic acid again, finally at the end it will be converted into acetyl-CoA. So acetyl-CoA is coming from glucose. Yes, acetyl-CoA is coming from glucose. This point I think you know, or from the Krebs cycle acetyl-CoA is coming. This acetyl-CoA will try to interact with choline. Actually, choline is it is a type of amino acid. Choline is the dietary product. Choline comes from the extracellular matrix, and from there it will be directly diffused into the cell membrane. Choline interacts with acetyl-CoA and it synthesizes acetylcholine with the help of choline acetyl transferase. Choline acetyl transferase, CHAT बोलते हैं इसको. Choline acetyl transferase converts acetyl-CoA and choline into acetylcholine. See, why this is important? Because if anybody has hypoglycemia, in that case acetyl-CoA will be deficient, or if anybody has choline deficiency, in these two substrate deficiency, acetylcholine deficiency occurs, and acetylcholine synthesis will not be seen. Because of that, we need to study all these things. Acetyl-CoA and choline both are substrates to synthesize acetylcholine, and here choline acetyl transferase is also very important. In some cases, if choline acetyl transferase deficiency is there, in that case also acetylcholine will not be synthesized. That cases also we will find. Now you see, acetyl-CoA plus choline synthesizes acetylcholine, and the synthesized acetylcholine will try to store in the vesicles of the preganglionic fiber. Whenever this preganglionic fiber stimulates, or whenever it is stimulation is required, what happens? The sodium or calcium ions will try to enter into this preganglionic fiber, and what happens? It will be contracted. When this presynaptic or preganglionic cell contracts, depolarizes, it will contract, and it will try to eject the stored vesicle with acetylcholine. So acetylcholine will be released into the synapse, into the ganglia. Okay, when brain or when it is required, when stimulation is required, it will release into the synapse के पास release हो जाएगा. And here in the synapse, on the, सब लोग ध्यान से सुनो, on the post ganglionic nerve fiber, on the post ganglionic nerve fiber, here we have n receptor. ध्यान से सुनो सब लोग. Here we have n receptor. When acetylcholine releases in the ganglia, this acetylcholine will go and bind on the NM receptor. And when it binds on the NM receptor, what happens? Immediately the postganglionic nerve fiber will be stimulated, and it will release, again it will release acetylcholine on the tissue. This is the general physiology. Acetylcholine synthesized, acetylcholine released, and when acetylcholine releases, it will go and fall on the receptors. About the receptors I'll explain now. Now you see, now very very important concept, सब लोग ध्यान से सुनो. यहाँ पे acetylcholine was released in the ganglia, right? Yes, acetylcholine is released in the ganglia. Clear? Yes or no? हाँ, acetylcholine ganglia के पास release होगा, and acetylcholine also releases in the neuroeffector junction at the tissue के पास भी synthesize release होगा, right? Wherever it is releasing near the place, or wherever it releases, it has at the place of releasing, we have one enzyme which is called acetylcholinesterase. Here ACHE. ध्यान से सुनो सब लोग. You can zoom and see. There is a very very important enzyme called acetylcholinesterase. Prajwal, you should listen carefully. Shivani, Krina and all. This is very very important. जहाँ पे भी acetylcholine release होगा, at the site of acetylcholine release, we have one enzyme which is called acetylcholinesterase. Clear? This acetylcholinesterase, what it does, immediately the released acetylcholine will be hydrolyzed. It will be metabolized. Hydrolysis is the process where acetylcholinesterase converts acetylcholine into choline and acetate. Breakdown कर दिया. Yes or no? See, whenever acetylcholine releases in the ganglia or at the site of tissue, उसकी action दिखाने से within minutes or within seconds, acetylcholinesterase will hydrolyze the acetylcholine into choline and acetate. Clear? अब देखो, if acetylcholinesterase enzyme is inhibited, what will happen? If acetylcholinesterase enzyme is inhibited, what will happen? Anybody from the class? Acetylcholine will not be hydrolyzed, it will not be metabolized, and the concentration of acetylcholine increases in the ganglia as well as in the neuroeffector junction, and through that what happens? Acetylcholine will get opportunity to go and bind on the receptors. It will go and bind on the receptors, and what it does, it will show more action of acetylcholine. Yes, acetylcholine की action बढ़ जाएगा. कब? अगर acetylcholinesterase enzyme is inhibited. There are so many drugs which are available in market. They will inhibit this enzyme. If this enzyme is inhibited, what will happen? It will increase acetylcholine actions. Now I will explain you in detail about the actions of acetylcholine on different tissues and on different receptors. Acetylcholine के actions सीखना चाह रहे हैं आप अभी? Are you all interested? फॉलोइंग. अब देखो, अब मजा आएगा. देखो आप लोगों को यहां तक सब लोग क्लियर है? Exactly. See, acetylcholinesterase enzyme tries to break down the acetylcholine. That is the main action of acetylcholinesterase. Okay. See, in cholinesterases we have two types of enzymes. Actually, we have two types of acetylcholinesterase enzymes. In that, ध्यान से सुनो सब लोग. Actually, it's the short form of this enzyme is ACHE, acetylcholinesterase. In acetylcholinesterase we have two enzymes. One is true acetylcholinesterase and one is false acetylcholinesterase. ध्यान से सुनो, ये बहुत इंपॉर्टेंट है. In cholinesterase enzymes, in cholinesterases we have two types. Two types matlab we have two determinants. One is called true acetylcholinesterase enzyme and the second one is false, or it is also called pseudo 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 acetylcholinesterase, or it is also called as butyryl cholinesterase. Butyryl butyryl cholinesterase, bute, butyryl cholinesterase. Okay, acetylcholinesterase enzymes, in that we have two types. One is true acetylcholinesterase and the second one is pseudo acetylcholinesterase or butyryl cholinesterase. Now you see, ध्यान से सुनो सब लोग. True acetylcholinesterase is present in parasympathetic nerve. ये याद रख लो, राइट समवेयर. ट्रू acetylcholinesterase is present in parasympathetic neuron. It is present in ganglia. गैंग्लिया में रहता ना, गैंग्लिया. इट इज मेनली प्रेजेंट एट गैंग्लिया, याद रख लो. इट इज प्रेजेंट इन आरबीसी. इट इज प्रेजेंट इन आरबीसी and it is present at neuromuscular junction. What is neuromuscular junction? What is neuromuscular junction? Neuromuscular is somatic nerve which is directly innervating in the muscle. In the muscle, somatic nerve रहेगा यहाँ पे. It will release the, see, somatic nerve may release, some somatic nerves will release GABA, some somatic nerves will release acetylcholine, some somatic nerves will release adrenaline. Anything, they can release anything, they can release anything. Okay, so if somatic nerve यहाँ पे, if it is releasing acetylcholine, so here I'm sorry, at this site it should be metabolized, no. यहाँ पे metabolize करने के लिए in this neuromuscular junction also we need cholinesterase enzyme. So true cholinesterase enzyme is present in nerve, it is present in ganglia, it is present in RBC, it is present in neuromuscular junction, and it is present in all parasympathetic nerves. All parasympathetic nerves. Clear? Yes, yes, Prajwal. Somatic nerves, some somatic nerves may release noradrenaline, yes, but predominantly, see, predominantly sympathetic nerves will release noradrenaline, and predominantly parasympathetic nerves will release acetylcholine. See, ये majority action ही है. Minority action sympathetic में, see, somatic nerves में थोड़े थोड़े very few nerves may also release noradrenaline or acetylcholine as neurotransmitter. Okay, यहाँ पे confusion नहीं है. See, and one more important point, see, just now what I told, sympathetic nerve will release noradrenaline, parasympathetic nerve will release acetylcholine, yes, but in sympathetic nerves, few sympathetic nerves also releases acetylcholine. Okay, parasympathetic nerves will release acetylcholine only, but few sympathetic nerves also releases acetylcholine. इसके बारे में मैं आपको बाद में डिटेल में समझा दूँ. As of now you try to understand these basic things. ये फिर आप लोग कंफ्यूज होंगे, सर क्या सर पूरा मिक्स करके बता रहे हैं. You will be confusing. True acetylcholinesterase enzyme is present in nerve, ganglia, RBC and neuromuscular junctions. Clear? Now very important, butyryl cholinesterase or pseudocholinesterase. Butyryl cholinesterase is present in plasma. It is present in plasma. Very important point. इसकी significance आपको बाद में पता चलेगा. And it is also present in liver and it is also present in glial cells of brain. Glial cells, ये इसका importance नहीं है, but pseudocholinesterase is determined in plasma of the blood and in liver. Now you see, sir, you are telling true cholinesterase enzyme locations and pseudocholinesterase enzyme locations you have told. Now, what is the difference between this true and pseudo in their action? There is a great difference between these two in respective action. See, true cholinesterase, what it does, true cholinesterase will rapidly I'm sorry. True cholinesterase enzyme rapidly hydrolyzes acetylcholine, whereas pseudocholinesterase will slowly hydrolyzes acetylcholinesterase. This is the main difference. And one more very important difference you see. True cholinesterase enzyme metabolizes acetylcholine, and it also metabolizes one another alkaloid which is called methacholine. Acetylcholine, carbachol, bethanol, aricoline, methacholine करके drugs है. All these drugs I'll explain in upcoming slides. True cholinesterase rapidly metabolizes acetylcholine and methacholine, whereas pseudocholinesterase slowly metabolizes acetylcholine and it has no effect on methacholine. It has no effect on methacholine. So this is the main difference between true cholinesterase and pseudocholinesterase. Clear everybody? Pseudocholinesterase slowly metabolizes acetylcholine and it has no effect on methacholine. Methacholine का मेटाबोलाइज नहीं करेगा बस. Whereas true cholinesterase acetylcholine को मेटाबोलाइज करेगा और methacholine को मेटाबोलाइज करेगा, very fastly मेटाबोलाइज करेगा. Simple. In cholinesterases we have two types, true, pseudo, and their locations we have seen and their actions we have seen. Now you see, if I inject acetylcholine, will I show actions of acetylcholine? If I inject acetylcholine through IV में दिए, will I show actions of acetylcholine? Acetylcholine के actions अभी देखे नहीं हैं, but you tell me. This is first question. Second question, if I take acetylcholine tablet, will I show acetylcholine action? acetylcholine का action दिखाएगा क्या? Anybody from the class? In first scenario, what will be the situation? Yes, tell me. In first scenario, it will show its action, and in second scenario, it will not show its action. Yes? Everybody is having same answer. Prajwal, do you have same? Just now I explained, I am asking this question to check whether your common sense is working or not. See, in first scenario, दोनों में नहीं करेगा. When acetylcholine is injected into the body through IV or through IM, what happens? Initially, the drug will enter into the blood circulation, right? From the plasma only, it has to it is to be circulated to all body parts. So plasma will be circulating the acetylcholine. In plasma, we have pseudocholinesterase, which is having hydrolyzing property. But see, it is having hydrolyzing property, but not as rapid as true cholinesterase. But still, it has action. So what this pseudocholinesterase does? Pseudocholinesterase will metabolize acetylcholine, which is given through IV route. So in first scenario, it will not show its action. Number two, if acetylcholine is given through oral route, what will happen? Acetylcholine तकलीफ से अगर absorb भी हो गया ना, it will enter into liver. Okay, in liver what we have? Again we have pseudocholinesterase will try to metabolize acetylcholine rapidly. That is called first pass metabolism. First pass में अगर थोड़ा बहुत भी निकल गया ना, छूट गया ना, तो next time when it comes it will be metabolized. So एक चीज confirm है, acetylcholine has no bioavailability. Bioavailability है, but it is rapidly metabolized in the body. And this is first reason. Second reason, acetylcholine has no specific action. It has unspecific actions. That point soon you'll come to know. Because of these two reasons, number one, it is metabolized rapidly and it is having unspecific actions. Because of these two reasons, acetylcholine is never used in the hospital. Acetylcholine is never used in the hospital. Why? Why acetylcholine is never used in the hospital? It has unspecific actions and it is rapidly metabolized in the body, in the blood as well as in the liver. Okay? Due to these two disadvantages, it is not used in the body. Now, very important. पूरे लोग ध्यान से सुनो. What we have seen, we have discussed about the parasympathetic nerve. Parasympathetic nerve physiology we have seen. How acetylcholine is synthesized we have seen, and how acetylcholine is released we have seen, and now how acetylcholine is metabolized, that also we have seen, right? Acetylcholine की fate पूरा देख लिया. We have seen the total fate of acetylcholine. Now you see acetylcholine, the acetylcholine which is released, it will bind on acetylcholine receptors, right? Acetylcholine, when it is released, it will bind on acetylcholine receptors. So in these acetylcholine receptors, mainly we have two types. Number one is muscarinic receptors, and number two nicotinic. ध्यान से सुनो सब लोग. Acetylcholine has two types of receptors. We are discussing about acetylcholine receptors, or we can also denote them as cholinergic receptors. Okay, acetylcholine receptors, cholinergic receptors, or parasympathetic receptors. Parasympathetic receptors. In that we have M type receptors and N type receptors. M type receptors are called, or are also called, muscarinic receptors, because they are mainly stimulated by muscarine, and N-type receptors are also called nicotinic receptors. Nicotinic receptors, because they are mainly stimulated by nicotine. And these two receptors are also stimulated by acetylcholine. Yes? Yes or no? Now you see, in muscarinic receptors we have M1, M2, M3, M4 and M5. 4 and 5. Total 5 receptors we have in M type, and in nicotinic receptors we have two types. One is NN and the next one is NM. ध्यान से सुनो सब लोग. These are 7 types of muscarinic and nicotinic acetylcholine receptors. Acetylcholine receptors कितने हैं? Total 7 receptors. In that 5 are muscarinic M type and 2 are nicotinic N type. The muscarinic receptors are specifically activated by muscarine, that's why they are called muscarinic receptors. Nicotinic receptors are specifically activated by nicotine, that's why they are called nicotinic receptors. अब देखो, यहाँ पे सब लोग ध्यान देना चाहिए. Everybody should concentrate. Different types of receptors we have seen. Whose receptors? Acetylcholine receptors. Okay, don't forget that. Now these M1 receptors are mainly located on गैस्ट्रिक ग्लैंड्स. ध्यान से सुनो, कहीं भी लिख लो. M1 is present in gastric gland. Second, M1 is also present in ganglia, and it is present in brain, central nervous system. अब देखो ध्यान से सुनो सब लोग. When M1 receptor is present in gastric tissue or in gastric glands, when M1 receptor in gastric gland is activated, when M1 receptor in gastric tissue is stimulated, the action will be excess release of gastric acid and excess release of gastric hormones. Like we have gastrin tissues, gastrin hormone, we have incretins, we have CCK, we have pancreatic related some hormones we have in the GI tract. So gastric acid secretion and gastric hormone release will be increased when M1 receptor is activated in the gastric tissue. Clear? Number 2, M1 is also present in ganglia. Ganglia क्या होता है? This is brain, this is preganglionic nerve fiber, this is ganglia, and this is postganglionic nerve fiber, and this is tissue. Here in the ganglia, here we have M1 receptor. अब मान लो यहाँ पे या यहाँ पे. Okay, on the post ganglionic nerve यहाँ पे रहता. Okay, when the M1 receptor is activated by acetylcholine, what happens? The postsynaptic or post ganglionic fiber will be stimulated. Okay, so यहाँ पे M1 के साथ N is also present. याद रखो, वो NN के बारे में बताऊंगा आपको. Remember one thing, mainly M1 is present in gastric gland. Clear everybody? Now M2 is present in heart. If M2 receptor is activated by acetylcholine, what happens? Heart will be depressed. cardiac output decreases, AV conduction velocity decreases, force of contraction decreases, and heart rate decreases. All the actions of heart will be decreased. याद रख लो, इसके बारे में और डिटेल में समझा दूँ आपको. Okay. Now M3 receptors. This is very very important. M3 receptors are present on smooth muscles. M3 receptors are present on exocrine glands, all exocrine glands. M3 receptors are present on endothelial cells, SEE. M3 receptors are present on smooth muscles. अब बोलो smooth muscles कहाँ कहाँ रहते हैं? Smooth muscles of GI tract, smooth muscles of urinary system, smooth muscles of urinary system, and smooth muscles of bronchioles. स्मूथ, ये देखो स्मूथ मसल्स कहाँ कहाँ, GI, especially on GI and urinary system and on bronchioles. These, when M3 receptor is activated or stimulated on the smooth muscles, it will increase peristaltic movement in GI tract. It will cause peristaltic movement in urinary system. It will cause, here it will cause defecation, here it will cause urination. And on bronchioles, it will cause bronchoconstriction because bronchial smooth muscles are contracting. Clear? ये asthma के time पे I told, in asthma M3 receptors are present on bronchioles. We have anticholinergic or antimuscarinic drugs. When this M3 receptor is blocked, what happens? The bronchoconstriction will be decreased करके बोला आपको, याद है कि नहीं? कि अभी clarity मिलेगी आपको, you will get clarity. Now you just understand the locations of every tissue. Okay. Are you all following, everybody? Yes. M3 receptors are present on all smooth muscles, all not all, on smooth muscles, particularly in GI tract, in urinary system and in bronchioles. Blood vessel के blood vessel के smooth muscle के ऊपर नहीं रहता, याद रख लो. Now M3 receptor is also present on all exocrine glands. It is present on all exocrine glands. Exocrine glands क्या है? Starting from lacrimal gland, starting from salivary gland in the buccal cavity, sweat glands, we have perspiration, क्या बोलते हैं, we have gastric glands, we have pancreatic glands, exocrine gland जो भी है पूरे, हर एक exocrine gland के पास M3 receptor we have. And when M3 receptor on the exocrine gland is stimulated, it will release all exocrine secretions. Clear? Now it is present on endothelial cells. Very very important. Third tissue. Endothelial cells क्या है? What are endothelial cells? Very good. Just see, this is blood vessel, blood capillary. On blood capillary, the capillary is made up of single epithelial tissue, right? This epithelial tissue, single epithelial tissue is made up of endothelial cells. These are endothelial cells. Blood vessel, blood capillary के endothelial cells. On these endothelial cells, M3 receptor is present. When M3 receptor is stimulated, it will release nitric oxide, NO. And when this is released, what will happen? In previous class, starting में आपको बताया था. How many of you understand? This will cause vasodilation. Very good. So M3 receptor activation on endothelial cells will cause vasodilation. अब बोलो, what will be the action of acetylcholine on cardiovascular system? Cardiovascular system is heart and blood vessel. On heart, it is depressing heart, and on blood vessel, it is dilating blood vessel. So what is the action of acetylcholine on CVS? Very good, excellent. It will decrease blood pressure. Very nice. M1 finish, M2 finish, M3 finish. आप देखो M4 and M5 एक simple सी चीज याद रख लो. M4 and M5 are present mainly in brain, in central nervous system. In central nervous system, if M4 and M5 is activated, it will improve the cognitive power of the person, or it will increase the memory power. Okay, थोड़ा cognition बढ़ाएगा. This is the M4 and M5 action. Okay, and now see, will M yes M1 action also, yes. M1 receptor in CNS, it also causes same cognitive power. Now we will go with the nicotinic receptors. We have NN and NM. Nicotinic receptors we have NN, right? And NM. ये बहुत important है, बहुत बोले तो बहुत important है. Most of the faculties will skip this. Muscarinic, anti-muscarinic पढ़ा देते हैं. Nicotinic न्यूरोमस्कुलर जंक्शन ब्लॉकर्स ये सब नहीं पढ़ाते, ये बहुत इंपॉर्टेंट है और थोड़ा बहुत कन्फ्यूजन रहता है, बट इट इज ईजी एंड इंपॉर्टेंट, ईजी एंड वेरी इंपॉर्टेंट। अब देखो एन एन रिसेप्टर, एन एन रिसेप्टर कहाँ रहता है इज वेरी इंपॉर्टेंट। एन एन रिसेप्टर इज मेनली लोकेटेड ऑन गैंग्लिया, गैंग्लिया। इट इज प्रेजेंट ऑन एड्रिनल मेडुल्ला, याद रख लो सब लोग, एड्रिनल मेडुल्ला, एंड इट इज प्रेजेंट इन सेंट्रल नर्वस सिस्टम। अगेन सेंट्रल नर्वस सिस्टम का एक्शन ये यू डोंट फोकस। एन एन रिसेप्टर इज प्रेजेंट ऑन गैंग्लिया। गैंग्लिया कहाँ है बोलो? दिस इज ब्रेन, प्री गैंग्लियनिक फाइबर, गैंग्लियन, पोस्ट गैंग्लियनिक फाइबर एंड टिश्यू, राइट? सी हियर वी हैव एन एन रिसेप्टर। अब एन एन रिसेप्टर एक्टिवेट हुआ तो क्या होगा बोलो? व्हाट हैपेंस इफ एन एन रिसेप्टर एक्टिवेटेड? इट डिपोलराइजेस पोस्ट गैंग्लियन, हाँ, पोस्ट गैंग्लियनिक फाइबर। It will increase the stimulation of parasympathetic nerves. Simple. It will stimulate parasympathetic nerves. And one more point. See this whenever acetylcholine releases here, if you inhibit N receptor, further acetylcholine activity रोक देंगे अपन. Okay. That's why it is very very important. And further activation के लिए N receptor and M1 receptor is also important. I told M1 is also not M1, I think. It is which one? Ganglia, yes, M. Yeah, M1. M1 here. On ganglia, we have M1 and NN. Clear? And on we have क्या बोला था आपको? Adrenal medulla, yes. Second, NN is present on adrenal medulla. Adrenal medulla कहाँ है? Adrenal medulla कहाँ है? Kidney. Kidney के ऊपर we have adrenal gland. In adrenal middle part we have adrenal medulla, and outer part we have adrenal cortex, right? Adrenal cortex releases glucocorticoids and all mineral corticoids. Adrenal medulla releases adrenaline, right? See, on these adrenal medulla we have N receptor. Acetylcholine आके यहाँ पे पड़ा, if acetylcholine falls here, it will stimulate an N receptor of adrenal medulla, and if this N receptor is activated, it will increase release of adrenaline. देखो, previously when I was explaining, actually whenever adrenaline action increases, adrenaline actions are opposite to acetylcholine. Acetylcholine actions are opposite to adrenaline, right? Actually acetylcholine will increase perspiration, it will decrease heart rate, and it will dilate blood vessels and all. ये सब actions अपन पढ़े already. अब देखो acetylcholine, if particularly acetylcholine falls on an N receptor, it will increase adrenaline action also. So mixed action of acetylcholine and adrenaline, both mixed actions can be seen in some conditions. ओके, सो इसके बारे में और डिटेल में आपको अपकमिंग क्लासेस में आई टेल यू. जस्ट रिमेंबर, एन रिसेप्टर इज प्रेजेंट ऑन गैंग्लिया एंड इन एड्रिनल मेडुला. When it falls on ganglia, it increases release of acetylcholine further, and when it falls on the adrenal medulla, it increases the release of adrenaline. Clear? Now N M, you see, N means याद रख लो, N means no, N means you remember it as ganglia, and M means you remember it as muscular. Okay, so M receptor is mainly located in neuromuscular junction. न्यूरोमस्कुलर जंक्शन. अब बोलो न्यूरोमस्कुलर जंक्शन कहाँ है? न्यूरोमस्कुलर जंक्शन कहाँ है? ब्रेन, प्री सिनेप्टिक नर्व, सिनेप्स, पोस्ट सिनेप्टिक नर्व, एंड दिस इज टिश्यू. और ब्रेन, सोमैटिक नर्व एंड डायरेक्ट टिश्यू. ओके, so these area, the junction between somatic nerve and tissue, the junction between somatic nerve and tissue, this is called neuromuscular junction. न्यूरोमस्कुलर जंक्शन के पास कौन सा टिश्यू है बोलो? न्यूरोमस्कुलर जंक्शन के पास कौन सा टिश्यू है बोलो? स्केलेटल मजिल. जस्ट नाउ आई टोल्ड, नो. सोमैटिक nerves are mainly innervated into the skeletal muscles. Did I tell you or not? I already. तो न्यूरोमस्कुलर जंक्शन के पास कौन सा रिसेप्टर है? एन रिसेप्टर है, एन रिसेप्टर. इफ दिस एन रिसेप्टर इज स्टिमुलेटेड बाय एसिटाइलकोलिन, तो क्या होगा? इट विल इंक्रीज कॉन्ट्रैक्शन ऑफ स्केलेटल मसल्स. इट विल इंक्रीज द कॉन्ट्रैक्शन ऑफ स्केलेटल मसल्स. सी, अगर ये सोमैटिक नर्व के पास, फ्रॉम दिस सोमैटिक नर्व इफ असिटाइलकोलिन इंक्रीजेस हियर, इफ असिटाइलकोलिन इंक्रीजेस, यहाँ पे देखो असिटाइलकोलिन के साथ साथ रिलीज होने के साथ साथ यहाँ पे असिटाइलकोलिनेस्टरेज भी रिलीज होगा, असिटाइलकोलिनेस्टरेज एंजाइम, असिटाइलकोलिनेस्टरेज एंजाइम भी रहता. Okay, if this acetylcholinesterase enzyme is inhibited here, what happens? More acetylcholine activity is seen on NM receptors and more activity is seen on skeletal muscles, and patient will have seizures, patient will have convulsions बोलते हैं, particularly convulsions. Acetylcholine can cause convulsions, yes or no? Acetylcholine can cause convulsions, yes. Why? Because it is stimulating an M receptor which is present on neuromuscular junction. अभी देखो, now I want to add one important point. There are some drugs called organophosphates. There are some drugs called organophosphates. These are pesticides actually. Especially they are used as insecticides. Insects कहाँ पे भी है ना, insects kill करने के लिए we use organophosphate compounds. Malathion, parathion, phenathion, abate, acebate, sarin, saban करके बहुत सारे, we have so many organophosphate compounds. These organophosphate compounds, what they does, you know, these organophosphates will inhibit acetylcholinesterase enzyme. Organophosphates, what they'll do, they will inactivate acetylcholinesterase enzyme. Now you tell me, if we take organophosphate compound, our body will be inhibited with acetylcholinesterase enzyme, right? तो अभी बोलो, तो what can be seen in the patient if this enzyme is inhibited? हाँ, असिटाइलकोलिन एक्टिविटी बढ़ जाएगा. देखो यहाँ पे असिटाइलकोलिन एक्टिविटी बढ़ जाएगा, M1 एक्टिविटी, गैस्ट्रिक एसिड इंक्रीज हो जाएगा, गैंग्लियन फिर से असिटाइलकोलिन एक्टिविटी बढ़ जाएगा. इन दी हार्ट एक्टिविटी डिक्रीजेस, M3 bronchoconstriction occurs, gastric motility increases, patient will develop diarrhea, patient will develop urination, patient's blood vessels will be dilated, and M4 M5 action is not, it is not determined correctly. अपन नहीं बोल सकते, sometimes confusion रहता, sometimes anxiety रहता, sometimes depression में चला जाता patient, mixed actions रहते. Okay. So M1 M3 M4, and on due to NN activity, what is the NN activity? NN activity further increases the release of acetylcholine, and activity increases, and due to NM patient will develop convulsions, all muscle activity increases. Okay, so these are the actions of, say these all are actions of acetylcholine. Acetylcholine acts on muscarinic receptors and acetylcholine acts on nicotinic receptors. I think you all understood the receptors of acetylcholine. Yes. अभी 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 क्या है, नेक्स्ट क्या बच्चा, कुछ नहीं बचा.